So I'm 23, I'm a pup. I fly to New York. I am surrounded by male plastic surgeons. I'm the only English female dentist, mental. And I smashed it because I came from dental background.
Yeah.
And then I came back to the UK and I started telling my patients, because I was working for the NHS at the time, that I do Botox and fillers, because that's all there was then. There wasn't even other things.
Yeah.
And I was a bit laughed at, I have to be honest. It wasn't, patients were like, what? It's just there wasn't the education there that we could provide this kind of treatment.
Welcome back to the Late Aesthetics Show, the podcast where we explore the artistry, science and trends transforming the aesthetics industry. Today I'm joined by the brilliant Dr Krystyna, a London-based cosmetic dentist and facial esthetician and founder of the Dr K brand. Known for her undetectable, natural-looking results, Dr Krystyna blends her deep anatomical expertise in dentistry with facial rejuvenation to deliver harmony and confidence for her patient. And your approach has learnt you recognition as a trusted voice in aesthetics. You've been featured across the media, collaborated with leading skincare and injectable brands, and built a thriving clinic focused on bespoke patient results. So in today's episode, we're going to talk about the rise of glass skin, minimalism, the role of supplements in aesthetics, and how she combines dentistry with injectables for complete facial balance. So welcome to the show. That was a lovely introduction.
Can you say it all again?
Yeah, say it. You're just going to keep repeating that to yourself like all the time.
It's okay, be like, see?
You're like, can I take this home? Yeah. Use it then.
Oh, thank you. Nice to meet you, babe.
You too. So you grew up around dentistry, so your background's predominantly dentistry based, and you actually did train as a dentist before you moved into aesthetics.
Yeah.
Was there a specific moment when you realised that aesthetics is where you want to be?
Okay, so not to tell a long story long or anything, but my mum and dad are both dentists, general dentists. They're retired now, so we're like the Von Trapp family of dentists, all a bit naff, but they've very much inspired me about the role and the job. But my mum, who is also very glamorous, she wanted to get some Botox done, and this was we're going back, babe, way back, when dentists weren't really considered practitioners to be performing these treatments. Do you remember that time?
Yeah.
So she flew to New York and went on a course in New York because she was like, I'm going to cut out the middleman. Like she's Polish, right? She's proper driven. She's like, I'm flying to New York. I'm going to learn how to do Botox. Came back to the UK. I just qualified dentistry. And she said to me, she was like, you need to go do this course. And I was like, what are you on about? Like, I don't even know what a tooth is. I just passed my test. And she was like, no, you've got to do it. This is where things are going to move into. She's very clever.
Yeah. So she kind of like foreseen that happening.
Yeah. Also, like, we all love a bit of a glow up our family. You know, my dad's surrounded by nutty women who just love all that kind of stuff.
Yeah.
I was like, okay. So I'm 23. I'm a pup. I fly to New York. I am surrounded by male plastic surgeons. I'm the only English female dentist, mental, and I smashed it because I came from dental background.
Yeah.
And then I came back to the UK and I started telling my patients, because I was working for the NHS at the time, that I do Botox and fillers, because that's all there was then. There wasn't even other things.
Yeah.
And I was a bit laughed at, I have to be honest. It wasn't, patients were like, what? It's just there wasn't the education there that we could provide this kind of treatment. So I think for me, I was inspired by mother to do it, like leading back to your question, but it took a while for it actually to come into action because it took a long time for people to see me as a dentist being able to provide these kind of treatments.
So when did you start? So you were you offering dentistry to begin with?
So I was doing NHS dentistry, knowing that really my heart was in cosmetics, cosmetic dentistry and facial aesthetics. So I started to take my dental path down the cosmetic route, and that's now what I do. With the aesthetics, I just constantly kept talking to people about it, but really no one was interested. And it got to the point where this is really being quite vulnerable, like I stopped telling people that I did it because I was so embarrassed because no one really kind of considered it as what I wanted, something that I could do. And then I started to do it for friends and friends of friends and myself, and it just grew from there because obviously I have an eye for it.
Yeah.
I've got that dexterity. And I am super passionate about it. And I think you can tell when you've got a passionate clinician, you do just get really good results because you can tell that they're so in it.
Yeah.
And then it naturally grew that way to the point where I then partnered with somebody who had a beauty salon, because again, this was when this was going way back before it was considered a separate kind of industry. Shout out to Bridget. And we built what is now the Skin Studio in Parsons Green. So yeah, long journey, but worth it.
Oh, nice. And you obviously, you say you've got an eye for it, which I think is really, really important. I think too many people go into this industry just learning a certain technique and then applying that technique to every single patient that, is coming through their door. But I always think it's really important to do a bespoke plan and a bespoke treatment. And how important is it to actually look at each individual face individually and then customize what you're going to do for that patient?
I mean, it's the most important thing. I get that there's textbook ABC 1, 2, 3 Botox, and there's general kind of rules and regs that you have to follow, but that's baseline, and that's a standard, and that will just make you a baseline standard injector. And this is so cliche, but it's not one size fits all. There's not one type of face, okay? So you've got to do it bespoke, because it's not just depending on the person's face, but it's also about their lifestyle, their budget, their downtime. I treat mums who've got newborn kids who Dr. K, I can literally only come in twice a year, in and out. They're busy. Yeah. I've got people that can come once a month and they've got all the time in the world. So we can tailor stuff around that.
Yeah, exactly.
You just have to manage expectations about what it's going to look like. But yeah, your question, that is the sole kind of thing about aesthetics is making it bespoke.
You've got to have an eye for it.
Oh, for sure.
And you said that...
An eye and a passion for it as well.
100%. Yeah. You can't just do it and think, this is going to just bring me some extra money. That's definitely the wrong approach.
Otherwise, it will do the opposite.
Absolutely. You said that dentists are generally not thought about being aesthetic practitioners. However, I've always thought dentists are really placed well because they study the anatomy of the face and the neck for, 6, 7 years?
Bloody hell, I know. Yeah.
Specifically to do that, specifically to learn anatomy. Yeah. So actually, I always think, dentists are actually very, very well equipped to deal with the face and the neck because that's what they've learned. Yeah. Is there any case where, for example, your dental knowledge has played a part in, let's say, an aesthetic injectable treatment?
Yeah, definitely, because exactly going back to what you said, we spent 6, 7 years, a very long time learning facial anatomy, but also, dexterity with needles and consultations, okay, so how to provide treatment for different types of people. A case whereby, for example, I can take into consideration skeletal formalities and facial features. That is where my dental knowledge and aesthetic knowledge can be combined. So, for example, your jaw, if someone's got a setback jaw, that's called a class 2 jaw, a protruded chin. Where can we balance their face? Chin filler. Yeah. Okay? Yeah. So that's where I can pull from both kind of industries. If I was just a dentist, the only option is potentially orthosurgery to bring the chin forward. If somebody really doesn't want to go and have really quite severe surgery, they can come see me for aesthetics and we can sculpt their face. It's so nice, isn't it? It's so aligned.
There's a partnership with it, definitely. If you had to explain to, let's say, a patient why dentists make great injectors, what would you say?
I think it's because, from a sensible point of view, we know how to take medical histories. We know what medications mean and what things could be contraindications to treatments. We've got vast medical knowledge and access to that knowledge as well. Also, for me personally, I, from the age of 18, was put in front of patients, so I know how to communicate with patients. I don't over-jargon things. I talk the talk, but for, like you say, consumer.
Yeah.
And I've been injecting inside patients' mouths, which is a very difficult place, by the way.
Of course it is. That's really...
it's not easy.
You need to light it up and everything.
You go dive in. Which requires a lot of dexterity and to be super accurate. Yeah. And just to circle back to that story when I was in New York, we had to practice a lot on each other. And what I noticed is that a lot of the plastic surgeons that were moving into aesthetics were quite aggressive with their because they're used to patients being asleep.
Yeah. Yeah.
We've got a patient that's awake, that's also terrified of the dentist. and we're having to perform these injectables. So you have to be super light and dexterous and mobile.
Yeah.
And that is something that's definitely been brought into my aesthetics injection technique, which I didn't realise until I'd seen other types of injectors.
Yeah. Well, even like now, there's very heavy-handed injectors, for example, and patients, like, you know, if they've maybe been to different practitioners, they'll say, oh, that really hurt that time that I went, you know, to see whatever practitioner, and then sometimes they'll go back to their original practitioner and be like, it never hurt like that before. Why does it hurt?
Patients need to kind of sometimes, they don't know what they've got. If you see a patient for the first time, that's their only experience.
Yeah,
so
exactly.
It's interesting when they sometimes have to pop around for whatever reason, and they come back and you're like, oh, and it kind of,
exactly. Like, that's good. So we're living in a time where social media plays a big impact on what patients demand and what they think is, you know, the right treatment to have and whatnot. There are buzzwords that are trending at the moment, like glass skin and skin minimalism. What's your take on that? And do you see patients coming to see you that are like requesting viral culture trends?
Yeah, for sure. I always think with these things, you kind of go, you know, these trends, you've got to be super careful not to, as a practitioner, hop on these trends just to get people through the door. The glass skin, the skin minimalism, before it was glowy skin, you know,
dewy skin,
no natural, like, you know, it's just it's reinventing the wheel here. And essentially, of course, it's everyone's goal, that beautiful, hydrated, healthy, bouncy, toned-looking skin. That's a bit of a waffly way of describing it, isn't it?
Yeah.
I totally understand these trends, and we just have to manage expectations of that. Like, if someone's going to come see us and they need a hell of a lot of work to get the glassy skin, we're going to obviously have to kind of manage that. And take away the whole, oh, we're just going to do one treatment and you wake up and you've got that glass skin for 3 months. It's just not going to happen.
No, that's not realistic.
Let's kind of bring this down
just
a bit.
Like put a filter on your face or something. That will get you that. But in actual like real life, that's not the case. Definitely, you look very different. Have you had patients come to you and asked for anything like wild that they've seen on like TikTok or Instagram?
The one that I get, actually, I'm just going to talk about dentistry for a second. The one that people always ask me about is coconut pulling for their teeth.
What is that?
Oh God, exactly, babe. Like,
what is that?
It's just, you know, I actually did a video on my Insta. Like, there's this woman and she gets these cloves and this coconut oil and she's swishing it around in her NutriBullet, and then she's swishing it around her mouth, and she's like, you guys don't need a toothbrush. And I'm like, what are you doing? Like, and she's beautiful, right? She's this beautiful girl, and it's complete nonsense. It's like, just brush your teeth with a toothbrush. But you get all these hyper trends coming in. Do you remember lip taping?
Yeah, that was a thing. Yes, yeah.
Where did that go? Came and went, because obviously it's nonsense.
But even like the new Kim Kardashian, like, you know, the facial.
Oh, the facial hammock.
Yeah. I mean,
if it helps with my double chin, but it's not going to.
It's not going to. Like, they use like post-surgery.
Of course,
like that's what they're used for.
I know.
That's not a thing. That's not going to catch on.
Decompression sock for your face.
Exactly. It's like you know, in Mean Girls, when it's like, stop trying to make fetch cool. Like, that's like Kim needs to just stop doing these random things.
Yeah, you're so right. And there does have to be a point where it's like, I think everyone just wants to go viral and jump on the next hype and make the next thing, but it doesn't have to be a sock for your face.
No, it doesn't.
Like, it's something that actually works.
But obviously, you know, like these like surgical companies that sell like post-surgical supplies.
They're having it off now.
They must be, because they sell them at a fraction of the price. And like,
we'll be walking around with
just oh, can you imagine? That's just absolutely nuts. Is there any, if you could like launch a viral trend in aesthetics that you would like, you know, people to catch on to, what do you think it would be?
Okay, I mean,
it's something,
in case I do become multimillionaire.
you know, something that's actually going to benefit patients.
I think what we need to all kind of, let's think of a really good idea where you can think of almost like a skin gym or something. I know there's like other fads like that, but you know, something that increases moisture levels. You could have some sort of infrared for inflammation and stuff, and then something that can elevate the collagen. Like one product that does it all would be great. Obviously, that's the wishful thinking viral trend that I would love.
Some like a nice at-home product.
Yeah. Increase moisturizer, moisture, collagen, and infrared or something.
Yeah, that's nice.
Should we do it together?
Yes,
let's do it.
But you know what? The point is, at-home beauty tools are really really big now.
I know.
And I think it started from COVID.
Great.
Some of them are great. Yeah, like I'll use an at-home LED mask every single day. I'll use it, religiously.
And it's nice. It's kind of a bit of meditation.
Wakes you up as well, all of that. I like it.
Yeah.
It's a good thing. But I think, since the pandemic, there's been a big shift into patients thinking they can just do a lot of treatments that used to just be clinic-led, that they can do them themselves at home. There's a line with you can't really do your own laser hair removal, for example. Yeah. Like, that's not really going to deliver the same at clinic, results at all. So the way that you view a patient, let's say you've got a new patient coming into the clinic, you'll always map each face. And we've talked about this, about how each treatment plan needs to be bespoke. Can you share an example of when, let's say, you've done a tailored treatment plan and it's really, really made a huge difference to a patient?
Yeah, definitely. I mean, I can think of loads of examples. It's mainly the brides.
Yeah.
I get a lot of bride glow-ups. Some of them literally give me like 2-week turnaround, which is a no. Do you get this?
It's like, wait, hang on.
I'm getting married in 2 weeks. It's like, what?
Why?
What? When did you propose?
Why are you leaving it this
You should be planning this before you even met
I know.
Come on.
This is it.
Long lead. Anyway, no, they're the best because for me, when the patients now know, because I've drummed it in their head, if you're getting engaged, I need a year because we tend to do teeth and face. And they're the best transformations because you see them so happy on their day. Yeah, it's a buzz, babe.
That's really nice.
You see them so happy on their day. The one that stands out to me, this lady, she had no lateral teeth, so her canines were put where her laterals are. So the symmetry's all off. She looks a bit vampire-y. She had bad skin as well. And so we did some Invisalign, we did some bonding, we did some hydro, full inside outside approach. It took a year.
Wow.
And she's never smiled before. And then she does on her wedding day. And I've got these beautiful photos. And I will never get bored of that. Yeah. That is worth it.
And how confident will she be as well? Exactly. Yeah. And she'll look back at them pictures and be like, that's like a really, really great
And you only get married once, hopefully.
Yes, exactly.
So you've got to do it. And she looks insane.
Oh, I love that.
And it's such a lovely feeling for me to know that I was part of that. So.
But how do you decide whether, let's say, a patient just needs injectables, whether they need skin boosters, whether they need skin treatments? How do you decide? And is it usually a combination of all?
It's a lot of things to decide. First of all, you've got to look at the age of the patient as well. I think that's the main thing. What's the goal? Is it just general maintenance, general facial aesthetics, anti-aging, or is it like for a wedding? If it's for a wedding, there's more of a plan, perhaps, to include more things. Whether I decide if it's one kind of injectable or collaboration, I will always collab skin and injectables together. Yeah. So skin treatments at home, in clinic, and injectables. Those three are the trifecta. And obviously it's just depending on what the dental condition's like, whether I bring that in or not. So yeah, it is depending on the case. But.
And how important is it to, let's say, not just only do injectables? Like, how important is the skin aspect?
Well, okay, so this is how I describe it to patients. Like, your skin has an outer layer and an inner layer, right? And outer layer is what you see, put your makeup on, and where you can put your lotions and potions and your creams, and you go for it at home. Yeah. And then my skin lady, my skin therapist, she can go a little bit deeper for the outer skin layer, really nourish that. But you guys, we all can't access our inner skin layer. That's where a needle can. Yeah. So it's like sandwiching your skin. It's like when I say sort of like if you get a vase, like skin treatments with skin therapists and at-home stuff is shining the vase. Injectables with the doctors, like filling the vase with water. Yeah. And that's the whole thing.
Yeah, definitely.
So, yeah, definitely.
That's a great combo.
Yeah, exactly. Yeah. On top and inside.
Yeah, exactly. And, I see quite often people combining dentistry with facial aesthetics because there is a real synergy with everything, obviously, that happens in the face. Yeah. How important, let's say, does the mouth and teeth really play in the whole appearance of the face?
Really important. You've got to think of, like I said previously, where the jaw sits, the expansion of the teeth, how big their smile is going to obviously affect things like lips, if they've got a gummy smile.
Yeah, exactly.
So let me talk to you about some sort of like dental aesthetics, like collaborations. Obviously, there are people who want to have a lovely smile and a lovely face. But, for example, if you're a grinder and you've had composite bonding, composite bonding can chip really easily. So where Botox comes in handy is you can put it in the masseter muscles to relax grinding. That's one thing. If you've got a huge gummy smile and you're doing teeth movement, and you can't intrude the teeth as much as you want to get rid of the gummy smile, you can relax it up a little with Botox.
Yeah.
So there's so many crossovers.
Yeah, exactly. Yeah. And there was a big trend, actually, going back to viral trends, about people being able to slim down their jawline by injecting like toxin.
Yeah.
Is that actually factual?
It is, and that's why you've also got to do it for the right reasons. So I'm a grinder because obviously I'm really stressed, and you've heard about my life. So I have to have a little bit, but I don't do too much because, as I'm sure you know, if you put too much Botox in a muscle and you leave it sort of in that semi-permanent state to relax for a long period of time, it will shrink.
Okay.
And that muscle, your masseter muscle, if it shrinks, yes, you will lose volume in the face, but you can also lose too much volume.
Yeah.
That you then become jowly. So you've created another problem.
Wow.
Do you know
exactly.
what I mean,
so it's got to be used in the right way for the
right
right
amount,
patient.
The right patient. Even grinders, myself included, like I say, I sometimes take a break from it and just deal with the fact that I sometimes have to wake up with that headache because I don't want to gel.
Wow,
Unless
exactly.
I have to wear Kim Kardashian socks to put it wrap it around my ears.
That's the only solution.
Do you know what I mean?
Literally. Okay, yeah. No, that's a very valid point, because I think sometimes people see trends on TikTok about, oh, I want a slim jawline.
Yes.
So I'm going to have
false advertising.
It is.
Gosh, I totally understand that. You've got to be so careful what you see on Instagram because, yeah, okay, Botox in the lower face. It was like when also people was getting those L-shaped jaws.
Yeah.
It doesn't suit everybody.
I know.
I've got quite square jaw because of the grinding, so I don't mind having a little bit of filler in the jaw of an occasion. But, you know, if you've got someone who comes to see you've got like a oval-shaped face or a heart-shaped face, why am I trying to alienise you by making you have like a square? You're going to look
it's not going to work.
Tetris shape. What is this? Like, it's not.
You're going to end up looking
aligned.
very unnatural, definitely.
Weird.
Supplementation is a huge part, I think, and I think it's still so underspoken about. I think people don't talk about it enough.
It's also a really complicated world, isn't it?
It's very complicated because, you know, you can go to any store and just there'll be supplements everywhere, and it'll be like Holland and Barrett, for example. The whole shop is literally full of different supplements.
I love that place, but
how confusing is it? Because you're like, I don't know what to buy. Like, it's very, very confusing. And then obviously you need to look at quality of ingredients as well. That's very, very important. How big a role does actually supplementation play in the overall external appearance?
Okay, so how I explain it to my patients is, if you take a collagen supplement, for example, you're suddenly not going to not wake up with your crow's feet. You know, you're not going to drink a collagen drink and then wake up and be like, I've got no crow's feet. Like, again, it's managing expectations. But if you take collagen supplements that are of good quality, good potency, regularly, I mean, you've got to be consistent. We're talking for like 12 months.
Yeah, and it's got to actually become part of your lifestyle.
Literally, it's not a one and done.
No, you have to continue doing
it. So it's part of your like matcha morning routine, whatever. You will see a generalized systemic, so that means like full body elevation of your collagen levels, but not huge. You're not going to suddenly wake up and be like, oh, I'm 10 years younger thanks to that tablet I took on Monday.
And I've been washing my face with water and soap, I've done nothing else.
So that's what I mean.
Yeah.
But I'm really into the supplement world.
Yeah.
I must say, of course, like I've been overwhelmed with it too. I'm not going to lie, even though I'm a medic, like I do my research, but there's a lot out there.
Yeah. And it's still not regulated in the UK. No. It's not regulated at all, so people can get anything.
And some of it's absolute nonsense.
Yeah, and if you take too many, that can actually have a backwards effect.
Well, it passes through you.
Yeah,
it's kind of
it's like sometimes with IV drips, for example, a lot of that will just, unless you really know what that individual's lacking by, you know, testing them and working out what they actually need, a lot of that's probably going to be wasted.
What supplements do you take?
I take like magnesium on a daily basis, mainly for energy levels, brain function as well. CoQ10 I take for brain function, which is really important. I take one called Nuchido, which is stimulating like NAD pathways in the cell. And a vitamin D. Right, what is the most unexpected lifestyle change that you've seen made a huge difference to skin or other treatments?
I'm not going to say supplements, I'm going to say sleep.
Yeah, that's underrated, right?
So I don't get enough, I'm a bit of an insomniac, but when I talk to patients about their skin from an injectable point of view, from a lifestyle point of view, from an overall anti-aging, regenerative point of view, what is underrated is the amount of sleep we get, or the quality of our sleep.
Yeah.
I have really broken sleep. I'm up and down. I take the magnesium, like you mentioned before. I have a whole night. It takes me an hour to get to bed now. I just do the lights off, the lavender. Like, it's a whole night routine process. But that is an underrated thing that actually doesn't cost anything.
No, it doesn't. But
sleep, it really does.
People find it really difficult to get sleep.
Of course they do. Like, we live in this crazy world at the moment where we're just constantly like stimulated and overstimulated. But actually, if you can get that sleep in, I know this was a bit of a naff answer. I wanted to say something glamorous, but
it's so important.
It is.
And you know how we spoke before about, like, obviously I'm between being up north and like down in central London. I have such better sleep when I'm up north.
Amazing.
Like, much better. It's completely
live in central.
Yeah,
literally. I'm surprised.
You know, it's like completely uninterrupted. I've got blackout curtains. Like, it's a brilliant.
Right, guys, don't get Botox, get blackout curtains. We're going to be out of a job.
Get some, like, we start interior designing, something like that.
All our clinics will just be blackout.
Just come in and sleep. But you know, it's so important.
There we go.
Do you know what? I actually think there's a thing for that. There's sleep therapy. There is,
yeah.
Even at airports, for example, they already caught onto that. Like, an airport pod, you go in for a little nap. It's fine.
Come on, be like, oh, should I collagen supplement? No, just a little nap.
All right. So, since you started in this great field of aesthetics, you've probably seen so many different changes happen over the years.
Definitely.
In the next 5 years, where do you really think that we're moving towards, and what do you think will be, you know, in and out in the next 5 years?
Okay, so I think in the next 5 years, we're all, as clinicians, going to still be investing in skin. It's just going to be what products, what injectables. That I can't answer yet, but that is definitely what we're still going to be moving towards. And it's going to be basically from, I believe, an aesthetics regenerative point of view, so a cellular biohacking point of view.
Yeah.
So I've been an aesthetics doctor for 15 years. How embarrassing. That's how old I am.
You look great.
I've been sleeping. No. And all we had was toxin fills. And, you know, you would upper toxin. So, you know, top part of the face, you put filler, that's all you had.
Yeah.
Then skin boosters came around, and that was a bit of a tough sell for me to explain to patients, because I was like, this is actually anti-aging your skin. This is elevating your collagen levels. This is doing the work. Botox was a bit of a plastering up a crack. Then we've moved on to polynucleotides, which stimulate your body-specific collagen. So there'll be something along that line, but luckily I think people that are in the aesthetics world now are more accepting and receptive of this kind of advancement, but it's all from a cellular level. So the next 5 years, I think, you know, people who are creating stuff and, you know, crack on with it, because I want something new.
That must say
it's going to be from that biohacking perspective.
Yeah, I agree with you totally. Yeah, definitely. I think we've gone past the point of having to, like, correct, and there'll be a lot of, like, things we can do from a preventative standpoint. Exactly. Also, the fact that you've got the Gen Z population coming in that are already starting. I know, but they are doing so many more things to look after themselves than we were doing.
I know.
You know, generations before were doing at that age. So they are just going to obviously live longer, but live healthier, because they're investing in themselves from a younger age.
I was talking to some of my Gen Z patients, and, you know, when I was their age, I was going out.
Everyone was going out. And they're doing, like, yoga and, like, doing matcha now. It's so different.
It's just like, God, you're going to look amazing.
Yeah, you are.
20 at 40.
And they're vegans and everything like that. It's like, it's crazy.
But we still have an age cap at our clinic. Like, we're not going to inject into anyone under 18 or anything like
that. Oh, no,
definitely not. We actually did it from 25.
Okay, that's
really... For injectables, obviously you can come and have things like hydrofacial skin treatments. But we just, also because it's like, age a bit, you know, live a bit.
Exactly, it's normal.
If you get too obsessed with it too early on, you know, you're not living as well.
Yeah, but going back to Gen Z, for example, they're looking after themselves, but in a really, really healthy way. Yeah, definitely. It is, definitely. And, you know, fair play to them. Like, I think if you look at people, for example, that are 60 years old, a lot of them have things like sun damage.
Yeah, oh God.
Because the education when it came to sunscreen wasn't available at that, you know, when they were younger, and all the damage was happening to their skin. So, you know,
we've all got our own entry points. Like, my entry point to this world was, like I say, predominantly tox and fills, and then obviously the skin boosters started to come around. My mum, it was just purely Botox.
Yeah, of course.
Botox and facelifts.
Yeah.
That's what people had. Bad facelifts. Yeah. And people have Kim K mum, Kris Jenner facelifts.
I know, yeah, she looks great. Yeah, fair enough.
That's saving.
Yeah, I know. I don't even know who a surgeon is.
I do. Yeah, don't worry, I'll tell you later. I'll tell you how much.
What excites you the most about this new evolution that we're happening?
I think I'm so excited because it's going to give people those undetectable, natural, subtle results, you know, which is what everyone kind of craves. And it's definitely going to be healthier and safer.
Yeah.
So I'm excited to see where things go, for sure.
Yeah, me too. Is there any myth when it comes to Botox or fillers that you would just like to bust once and for all?
Okay, Botox doesn't get rid of your wrinkles. I like that you're nodding. You've heard this a million times.
I've had patients come into the clinic and be like, can I get a refund, please? Because you did like 3 areas of toxin and I've still got wrinkles.
Well, you're 55. What do you
expect? Yeah, well, you're 55 and your wrinkles are about this deep. What do you expect?
Like turquoise crisp on your forehead. Come on. No, so Botox, one myth bust, Botox does not get rid of your wrinkles. It relaxes the muscles under your skin, which stretches the skin. Yeah. So it's a little bit of a false positive. So you cannot rely just on that. Mm-hmm. And a filler myth bust is that all filler is bad. No, like my face isn't real. Like it is full of it, but it's done at the right place at the right time, with the right product.
That's I was just going to say, with the right product. That's
with the
so
right
important.
Yes,
yeah.
You know, I have sadly, really sadly, seen some people who've got the boiled egg faces because they've had this awful filler done with a non-medic practitioner, and I do stand up for that. Yeah, I'm not here for it. And so then people have this conception that filler, they just associate it with botch or overdone, and that's not true. Filler can be done so classy and so well, but it's very advanced, and you have to see a doctor and a medic for that.
Absolutely, yep. So if you were the Prime Minister of the UK and you were in charge of regulating aesthetics and putting the rules into place, what would be the first thing you would do?
I think it would be to just make sure that this industry is way more regulated, and you are only able to provide and perform these treatments if you hold some sort of medical qualification. I've seen too many harrowing things. I've seen these things on TikTok where these girls were injecting each other in the back of their car with no gloves, no sterilisation, blood everywhere. Like, it just blows my mind. I've had to pick up so many cases where we're doing rehab work, on young girls. It's just not great. And, I think for me, I was talking to a non-medic injector once, and look, I get it, I understand it wasn't considered a medical profession for a long time, so I understand there's a lot of beauty professionals who are in this. And she said that she never gets nervous injecting, and I said, that's because you don't know enough. The anatomy knowledge I've got, and, I'm constantly double-checking, triple-checking, being overcautious about where the facial anatomy sits, where the arteries sit to avoid necrosis, if there was someone on special medication, what I can't inject, if there was someone who had an infection afterwards, how do I deal with that? Mm-hmm. And how on earth are all these non-medics able to be able to cope?
Yeah.
If someone has an infection, they can't prescribe antibiotics. Mm-hmm. So it's then someone else's problem.
Exactly.
You want to go as a consumer, a client, to a person who can obviously provide incredible work, but also be your safety net if things do go wrong. And even in the medical world, things can go wrong. There are risks to all these treatments.
Yeah.
So surely you want to be with someone that knows how to handle those risks.
And that's ultimately what, translates into the price. And I think going back to...
That's good point.
Well, it's really, really true, because going back to your point of why do members of the public why do they think it's okay to be injected in a toilet, a car, for example? Like, it's that clearly something is not right.
Where's
there.
Education lacking here?
But I think it comes down to like these Groupon deals and like voucher deals for like these cheap treatments. Like, if it's cheap, ask yourself, why is it cheap?
Buy cheap, buy twice, babes.
Well, totally. You don't know what product's being used.
No.
You don't know how
they're getting the product.
It's probably not even like from a regulated pharmacy. No. That's why it's been able. They probably buy it off like TikTok Shop or something, or of Amazon or something like that.
Imagine.
Well, I've seen like recently these, it keeps coming up on TikTok, and it's like salmon sperm, but it's like it's pink. And it's like in a vial. I'm like, who's buying pink, liquid to put on their face?
Yeah. It's just bleach.
Why is it? It looks like Domestos or something.
Okay, I think this is where the education needs to do a pivot. If it's down to price, and I understand cost of living, etc., but cost of living versus anti-aging, what's more important, food or face? No, joking. But I think people need to know that as doctors, we have indemnity, we pay for insurance, we pay for licensing, we've paid for our education, we pay for top quality products.
Yeah.
All of this is, like you say, factored into the price.
Yeah.
So you know that, you might be paying a little bit more for your Botox, but you absolutely know that you're getting good quality Botox and good quality aftercare. I pay that.
Yeah. And, it winds me up when patients send you inquiries, how much is 1 mil of filler, how much is 2 mils of filler? It's like, that really is not the question that you should lead with.
Where's your how many years experience has your doctor had?
Yeah, exactly. Hang on, let me just rephrase that for you. I think you've jumped like 10 steps ahead to asking about price.
They're the patients that you don't want to treat.
100%, because they will just purely go for the cheapest without actually considering the other things.
Yeah. And by the way, I'm not going to discredit, budget is something that we do actually factor into our plans.
It's important.
Whenever we do treatment plans at the aesthetics clinic, we write down what we would recommend and we write down the price. So we are so transparent with it. Okay. So it's important that you factor in. If it's not within your budget, you're not held. There's no gun to your head.
100%, exactly. No, it's a very, very, very valid point. Is there a specific beauty treatment you would never give up yourself?
Babe, how long you got?
Like
we've already been talking for 40 minutes. Okay, I will always do Redensity Skin Booster. Brand name. It is just my everything. I'm obsessed with it. I'm addicted to it because it's hyaluronic acid.
Yep.
It's got a vitamin complex. It's got amino acids, antioxidants. So it's a skin booster with all these other things.
Okay.
You can inject it everywhere, under the eye, forehead, not like just Profiler, which is neck, And you do just get this amazing glow. It's a really good adjunct to your Botox. So I'm 38, really old, and I used to have Botox every 3 to 4 months.
Yeah.
I now have it much less.
Yeah.
Because of Botox resistance, knowledge and awareness, and because I have mega upped my skin boosters, particularly Redensity. I have it all the time.
And how often do you do that then?
Babe, as much as I can.
Are you talking like...
We've got no downtime before the next one.
Is this like a weekly?
No, I do it
monthly?
Once a month. It's a skin booster, and I do a full face once a month. Some patients, if they want to use it and they want to have a localized treatment, so they're doing under eye, they might have 3 sessions over 3 months, or tailor it to the patient. But me personally, I do a full face skin booster once a month.
Yeah.
More is more. It's not causing any long-term effects apart from anti-aging.
Well, it's just beneficial.
It's just beneficial.
Yeah, it's literally beneficial.
Obviously, you might get the odd bruise, etc. here and there, but I'll take that.
Yeah, of course.
Hopefully, looking a bit
That's
younger.
cool. I like that.
I love it.
Is there one thing that patients would be surprised to learn about you outside of the clinic?
I did a reel on this, and look, I've got this position. I'm a dentist, I'm a doctor, aesthetic doctor, so you kind of automatically have that hierarchical kind of position in the clinic, right?
Yeah.
Patients think that you're super confident and da-da-da-da-da and all this, and obviously I'm very tatty, but I have been crippled with insecurities for it actually gets me a bit choked up sometimes I talk about it. For the last 15 years, I've gone to therapy about it. I used to have body dysmorphia, all the things. And I opened up a little bit about it. I mean, I just thought I didn't want to jump on any sort of trend about this. But I did talk a little bit about it on my Instagram, and it absolutely blew up because I think people didn't expect me to feel that about myself.
Yeah.
Because of the industry that I work in. And I was like, well, that's the irony. I've been so obsessed with aesthetics and cosmetics. At the beginning, it was from an insecure place because I wanted it done because I didn't feel good enough, right, without it all. Now I've done the work internally, mentally, to realise that it's, I enjoy it, but I don't need it to be a good person. But there was a lot of mental health work that I had to do with that too, which surprises patients.
It's surprising. But you know what? In a way, you will be able to relate very much to the patient that you see, in front of you on a different level from your own experience. Yeah, exactly.
I think because I can clock it as well. I can clock when patients are coming in because they want to fix because they're not feeling themselves. And I'm like, well, hold on a second. You booked in for lip filler. Your lips are fine. We've done them 6 months ago. We're not doing them again. What's actually going on here? And then you can unpick it, and they're obviously feeling a bit meh. It's like, we'll go for a facial. Or let's do a skin booster. Or let's just have a chat.
Exactly.
So,
Yeah, and I like the idea of the facial because you always feel so much better after a facial.
Don't you just?
Yeah, it's great. Everyone should be doing them very regularly. So we'll have a fun, rapid fire round now. So do you prefer coffee or champagne?
Coffee. I don't drink.
Do you not drink at all?
Drink at all.
Well done. That would be why your skin.
Every day.
That's actually a really good point that we should have mentioned. It's great not to drink for your skin.
Yeah, definitely.
It's good.
But I do because I hate alcohol. I hate the taste.
Fair enough.
So yeah, coffee all the way.
Okay. Favourite spot in London to unwind? It's funny because it's London.
I was about to say, not London. I'd be
outside of London.
Can I say something naff like the gym? That is my little
I
get that. I love the gym. Sorry to be boring, guys.
But nowhere specific, like anywhere outside of it, it's fine. What does natural beauty mean to you in 3 words?
Okay. Undetectable, subtle, healthy.
Very valid. And if you weren't in dentistry or aesthetics, what do you think you would be doing?
Do you know what? I say this all the time. 2 things. Either I'd be a PA because I'm so organised, I'm so on it, or I'd love to work in like PR and marketing.
Yeah, it's good.
I love chatting about brands and building the kind of story behind stuff, which is sort of a little bit what I did with myself.
Well, I was going to say, you've got your own clinic, so obviously you've had to build the brand around that as well.
Definitely.
So there's an element
and no
of
one
that.
teaches you that at dental school, by the way, when you're drilling a tooth.
It's true, yes. Yeah, my background's business, so it's different. Yeah, and I often view a lot of practitioners and I'm like, don't feel overwhelmed because you don't have to do everything yourself. Like you can get support and get additional people in. You can't do everything yourself sometimes.
It's really hard, honestly.
Yeah, it is.
You're thrown into medical school for 6 years. You're then booted out the other side, and it's like, go build your life. And you're like, okay, well, I know how to do the dentistry. I don't know where I picked it up. I think it was just a natural progression. But I definitely think if I wasn't a clinician, I would definitely do some PR and marketing. I'd get a real buzz from it.
That's cool, very good. So thank you so much for being such a great guest.
So much fun.
I definitely think you bring a unique edge when it comes to obviously blending the dentistry with the aesthetic side of things, which I think, the two go hand in hand really, really well. So for those listening, where can people connect with you and learn more about your work?
Okay, so you can come follow me on Instagram, Dr Krystyna. If you want to come in for dental treatment, I work at the Battersea Power Station, White & Co Dental Clinic. And for the aesthetics treatment, it's Skin Studio in Parsons Green. And we can just have a good old natter.
Brilliant. Thank you so much.